name is Tennille. I wanted to talk to you a little bit about the different modalities that I do and what they feel like. So we'll start with Swedish is your basic. Starting for any modality we're going to do, it's going to put the lotion or oil, whatever we're using in that moment, over the skin, help us palpate the muscles so we can feel where your tension is, trigger points, and where we're going to be working. It helps us assess what's going on with you. It also warms the muscle tissue up. We always warm the tissue up first, softens the muscles, that way we're able to sink in without causing any tearing. So Swedish is a very light, soft, fluid motion that's relaxing and kind of sets the tone for your massage. Deep tissue. Deep tissue can be done with 5 grams of pressure. It doesn't have to be deep. It's hooking in, like right there, hooking into the muscle, and you come to a place where it's a little congested and you hold it for a minute. And you wait. And then it's softening, it's almost there. And then you can continue. Sometimes it can take forever to go down one muscle. But that is actually slowly opening up the whole muscle, and the work actually lasts up to 24 hours later. So it's continually releasing post your massage. So it's a very slow modality, but does very, very well for opening things up. We have neuromuscular therapy, also known as trigger point. People refer to those as knots. That normally is working the tissue out around it, kind of getting it centered to the actual trigger point, and then a lot of going to the head of it and pressing, putting ischemic pressure on it for about 10 seconds and then releasing. Sometimes you'll feel like a little twinge, and that means it's about ready to go. Can't always release a trigger point, but man, I get excited when I do. And cupping. Cupping is fun. I use 2 different styles. You have your silicone cup. Different muscles, different areas, the way the muscles are feeling depend on which ones I want to use, but it does suction. These can go 4 times deeper. They go 4 layers deeper than what my hands can. I use these when muscles are very, very tight, locked up, very congested, or on a trigger point to pull it to a head. This helps me get more work done than I would have in that time being with my hands. 5 minutes of cupping is equal to 30 minutes of deep tissue. So I have these ones right here that I use, and I also have these ones right here, which I don't think I'll be able to stick it on myself. Maybe. They're fun. Look at that. Fun thing about cupping is you can slide it on the body, and then when it comes to a place, ooh, I put a little more pressure. When it comes to a place that's congested, like it can be like just a little bit, comes to a place that's congested, it'll stop. It kind of tells you, I need to be here. Normally when that happens, I'm like, does that feel like that needs to be there? And they're like, yes. Okay, good. And then I'll use it, move it around different ways to help stretch and pull the stuff out. But then after I remove it and I come back to that area, I'm normally able to get deeper into it and move more congestion out of that area. So I do love cupping. I don't do that as just a special modality. If someone wanted full cupping, I could do that. But I do like to use my hands. I'm more hands-on, and I use these when needed. I always ask permission first. I think I do some stretches, depending on the area and what's going on. I do try to do some stretches, and I like to show people stretches post as well that they can do when they go home for at-home care. All about healing and improving your flexibility. And I believe that's about it. Thank you very much. You have a great day.